Hospital-acquired infections affect 1.7 million patients annually in the U.S. and cost the U.S. healthcare system over $6.5 billion. The number one defense against hospital-acquired infections is hand hygiene. However, current hand hygiene adherence rates in hospitals is currently less than 40%. To address this problem, our competitor systems have developed several hand hygiene reminder systems. This is an example of a competing system. In competing systems, every sanitizer and soap dispenser in the hallway and inside the room is equipped with a sensor. Every healthcare worker wears some form of identifying tag, badge, or pocket device, and every doorway sensor is equipped with motion detection. These systems track unnecessary opportunities because if a nurse enters and exits a room to talk to a patient, the system records 2 unnecessary, unsuccessful events and generates 2 reminder signals. And over time, the false reminder signals train nurses to not pay attention to any of the reminder signals. This system requires dozens of sensors, and on average, our competitor systems cost around $2,000 per patient room. These systems are doorway and patient room based, which is not how we think about hand hygiene. We associate hand hygiene with the patient, not their doorway. CleanSpark redefines hand hygiene to be patient-centered. Only 2 sensors are required. The first is a Bluetooth transmitter attached to the patient ID bracelet. This transmitter forms a zone around the patient and their immediate environment. Depending on where the patient is located in the hospital, the zone will change size. For instance, a patient in the hallway needs a smaller zone than a patient in the room because their environment is smaller. These zones are also mobile, meaning they move with the patient, so hand hygiene can be tracked in hallways, bathrooms, radiology, and therapy rooms, as competing systems do not include anything but the patient room. No false reminders are generated, as the provider wears a wristband sensor that detects when they have entered or exited a patient zone. Hand hygiene is only tracked and reminders are only generated when a patient zone is entered. Therefore, the provider can enter and exit the room to communicate with the patient without requiring hand hygiene. The wrist sensor on the provider will also include an accelerometer to measure the hand washing motion. Therefore, dispenser sensors will no longer be necessary. The sensor will also include a temperature and humidity sensor. Therefore, it can sense when gloves are applied or removed. Competing systems do not do that. All of these capabilities are similar to those in basic fitness trackers and can be produced for less than $30. The patient sensor costs less than $6. This is a cost-effective alternative to competing systems. Our target market segment is the 5,500 hospitals nationwide, which involve 2 million nurses, 122,000 physicians, with future expansion into the worldwide market and places like care centers. CleanSpark will revolutionize how we track and measure hand hygiene, and it will be an effective tool for preventing hospital-acquired infections.